On this episode, we'll talk about hyperpigmented scars. We'll also talk about rupturing your sleeve down the road, and we'll also talk about adjusting medications down the road. Hello everyone and welcome to episode 85 of the AskDrA show. I'm Dr. Alvarez from Endobariatric.com. Thank you so much for submitting your questions this week. Thank you for sending the questions our way. Of course, you know the drill two ways. Either you use the hashtag AskDrA on social media or through my Snapchat account. If you haven't downloaded the Snapchat, you gotta be on Snapchat. Let's go into the show.
My scars are hyperpigmented. It is normal?
All right, so hyperpigmented scars, or in other words, the scars a little darker than the rest of your skin, is it normal? The answer is it does not go along with the surgery. Normally, it's the way, it is not really related directly to the surgery. In other words, it is a way you scar. So everybody is different. It's the way you scar. If you have other scars in your abdomen, that is the way they're going to be. It doesn't have to be related directly to the sleeve, or it's just because it's the sleeve surgery. It's the way you make scars. So there are some tricks you can change or avoid this. Number one is try to avoid sunlight. Number one, do not get direct sunlight. It's especially the first 6 months after your surgery. Avoid tanning, of course. Cover your incisions or direct sunlight. All right, that's number one. Number two is you can apply some scar cream. It helps, like Mederma. Those work, but it's kind of like a hassle. You have to use it morning and evenings for a period of 7-8 months until you see some good results. All right, so and the other is go to a dermatologist, get them treated with local injections or laser therapy as well.
Can your stomach rupture at any point after sleeve?
All right, can your sleeve rupture? Can your sleeve burst at any point down the road? The answer is once your stomach has healed, no, it is your own stomach. So, but once it is healed, now, if it's going through the healing process and you don't obey the diet or the guidelines, or you're messing around or fooling around with your stomach, can you cause it to burst or cause a leak? The answer is yes. So be very careful. I always tell my patients, please understand that it's extremely important you follow the guidelines or your doctor's guidelines after your surgery, because it is the healing process. Once your stomach has healed, it will stay like that forever and ever. Now, if the question is coming in a way of, because I've heard it, doctor, if I get on an airplane and a pressurized cabin, will it cause my stomach to burst? The answer is no. If I scuba dive, will the pressure cause my stomach to burst down the road? The answer is no. If I take a carbonated beverage, will that gas make it burst? The answer is no. So on and so forth. You get the picture.
When we lose weight, does it affect the dosage of medicine we take?
Yes, it's a very good question. So if you're this size and you take a blood pressure medication to a certain dose, medication for your diabetes to a certain dose, and a medication for your thyroid to a certain dose, and you start to slim down and your mass, your body mass starts to come down, will you need adjustment of those medications? The answer is yes, okay? So we do recommend you follow up with your primary health physician or the doctor that has you on this medication, because as you start to slim down, those medications do need adjustment, some fairly quick, some a few weeks out, maybe 4 or 5 weeks out. You will be coming off some of the medications, probably so. So it depends on the medication, on the dose you're taking, and of course your body and the amount of weight you've lost, and the way we have to start adjusting those medications. So yes, you do need the adjustment. You need to be following up with your primary health physician or the doctor that has you on this medication. All right, so that's it for episode 85. Question of the day is, did you require adjustment, medication adjustment? Yes, no. What medication did you adjust? Answers below on the comments section. I also wanted to let you know that, well, if you have any of my books that we have on Amazon, I really appreciate it. We've got the Bible, the Gastric Sleeve Bible, that's called Successful Weight Loss for the Gastric Sleeve, and the AskDrA shows, and etc. Just want to let you know that we now finally we have the Successful Weight Loss with the Gastric Sleeve. We have it now in Spanish, and it's also available for all the Spanish speaking community. It's also available now on Amazon. All right, so I'm Dr. Alvarez from Endobariatric.com, where we are changing lives one sleeve at a time. We'll see you on next week's episode.